Let us all unite and celebrate together the victories won for our liberation. Let us dedicate ourselves to rise together to defend.
Hello everyone, welcome to Africa and Diaspora News. It's Abomorita. On today's episode, we shall be discussing about muscular dystrophy, the causes of muscular dystrophy, and how it should be handled. Believe me, you don't have to skip this video for any reason. Make sure you like this video, subscribe, and share this video. When you do so, you are helping this video to spread to a greater number of people. Muscular dystrophy is a disease that causes the muscles to weaken and degenerate over time. It is a progressive condition that can cause one difficult to walk, stand, and perform other daily tasks. In Africa mostly, when cases like muscular dystrophy occurs, most parents believe witches and wizards are involved. Please, for more details about muscular dystrophy, click on the link below.
Muscular dystrophy. You will be seeing more of Dr. Temitope Farumbi on this show. MD, PhD, a dedicated neurologist and global health advocate with a focus on advancing brain health through innovation, research, and strategic leadership. She's the founder of Whole Health and Brain Health Initiative in Nigeria. She presently works at the University College Hospital, UCH in Ibadan. Of course, my very first question is, what causes muscular dystrophy?
Muscular dystrophy is a rare muscle disease that results from a genetic mutation and it is hereditary. It can be transferred to a child by both parents, but male child gets to express this disease more, especially when their mom or female child carries it and then transferred it to their male child. It is hereditary, it's genetically transferred from parents to a child. So it has nothing to do with witchcraft or evil spirits.
So, but is it always hereditary?
Muscular dystrophy is always hereditary. It has to do with a genetic mutation during the formation of eggs and sperm to form a child, and then there's a transfer of that abnormal gene from the father or the mother, but in most cases from the mother who carries that gene to a male child.
So, but we've also seen instances where neither of the parents displayed any symptoms of muscular dystrophy, but the child has it. How do you explain that?
Both parents may not have it. Maybe the father is not a carrier and the mother is a carrier, like I said. Being a carrier means that you have that mutated gene in your system, but you are not expressing it. It's not at the level whereby the disease will be prominent or will be seen. But then you carry it in your body, in your gene, and you can transfer it to your child. So a female can be a carrier and then she will not express it or have a milder form. But when it is transferred to their male child, then the symptoms of that disease is now expressed in form of expressed in that child. So both parents may not show anything, but if you do a genetic study of both parents, one of them, oftentimes the female, be a carrier.
Is it also possible that they don't give it to all their children?
The percentage of transference is like 50%. So it might be, some children may have it, some may not have. And some may have a trait. Let's say if you have like 4 children, one may not even have at all, two may have a trait, and then one will express the disease. However, for those who do not express the disease, it's important to actually do a genetic testing. They might be a carrier.
Okay, that's actually my next question. That is it possible for parents to know before they even get married? Is it possible for them to know whether or not they are carriers of the traits?
Yeah, it's possible, but genetic testing is not part of the usual one that we do as a routine test, unlike the sickle cell diseases that we check, because that is easy to check. But for muscular dystrophy, except there's a family history or there is high index of suspicion in maybe perhaps the grandparent have muscle disease or the other. That's when it is important to check so that you don't even marry two carriers, like a man also having it or somebody who is expressing is now marrying a carrier, because a rare disease is not something that is very common.
Is there any treatment for muscular dystrophy? Is there a way to prevent the muscles from degenerating?
Yeah, there is no cure. Like we said, it's a genetic problem. It's until science is, we are still doing a lot of research in that area in genetic treatment where they can remove. Like, of course, we've gotten a very good success in sickle cell disease. So the science is still ongoing. Research is still ongoing to be able, but there's no cure at this moment. However, there are treatments, physiotherapy, kind of exercise that the patient will do to improve we say exertional exercise, because you don't want anything that will further break down the muscles. So you do a low exertional exercise, and then also you want to look at the diet. Don't want a very high protein diet that will break down that will cause further increase of creatinine to worsen.
You're saying that they shouldn't eat a lot of protein.
No, in moderate, because the muscle is breaking down and it's increasing. There's something they call creatinine kinase that is a product of the muscle breakdown, and if excess of it in the body can even cause kidney damage. So you don't want to have excess of protein and you don't want to have less of it. So a moderate diet. So you need to talk to a dietitian. Energy also. So you need good carbohydrates. So you need a dietitian, you need a physiotherapist. It depends on that part of the body. If it's affecting muscles of the tongue or muscles of the face where speech is a problem, you might need a speech therapist to help here. Like I said, there is absolutely no treatment, no cure, but we can treat symptomatically based on what the patient is expressing.
Are you saying that this can affect any muscle in the body? You just talked about.
Yes, it can affect the muscle of the face, it can affect the muscle of the heart. Actually, what really leads to death in them are when affectation of the muscle of the heart, such that the heart cannot pump as it should, or muscles that supports the lung, and then they have breathing difficulties.
Why is it that some people don't show any symptoms until they get to a certain age?
There are different types of muscular dystrophy. The commonest one is Duchenne's dystrophy, where that you see in younger children between the age of younger male between the age of 3 to 6, and then there's another one, Becker's. So, and I'm not going to bore you with different types, but different types have the different degree of expression. Before, they used to say that muscular dystrophy is just a disease of the younger adults, younger children, but now you can see some in their early or late teens. Some may start expressing it when they are teenagers or in their early adult year, while some may express it very early. So there are different types, and it depends on that part of muscle that it affects. What basically happens in muscular dystrophy is that the muscle is self-destroying. It's not having enough strength to continue, so it dies. So it depends on that part of the muscles that dies, and also it depends on that part of the gene that the mutation is, and the level of expression differ based on that where the mutation is on that gene. So some may express it early, some may express it in their teen age, or some may express it in late age.
Hmm.
We've seen people expressing it even in perhaps in their middle age, but it's very rare.
Is there anything, let me start with the family, what they're supposed to be doing? Is there anything that as a society that we're supposed to do? And is there anything that the government is supposed to do to help people living with muscular dystrophy?
Yeah, for their immediate family, it's important for them to have understanding of the condition. Once they have understanding that it's a genetic condition, it helps better to be able to support them. Yeah, and what do they need to support them with? Of course, some may need support for walking, some may need support for eating, even for bathing. and as time goes on, even for usual daily activities of living. I know it can be very daunting in supporting such people, because that means that government needs to provide, and this is where community comes in, to be able to support such families, because any carer, perhaps a family member or parent who is caring, is using their valued time to care for this person. So government needs to come in to provide support funds for people like this. At the community level, also be able to create social amenities for those in need of physical therapy, as well as movement and also transportation, and then to be able to equip our local primary health centers for them to be able to have access when the need arises.
I'm glad you touched on that because this lady, for example, went from hospital to hospital to hospital, and the doctors had no idea what was going on. And if the doctor doesn't know what it is, then the family members automatically believed it's the works of the witches and wizards.
It's because it's a rare condition. It's unlike malaria that everybody knows malaria. But a doctor should have high index of suspicion. What is important that we should be able to do is to refer and also always ask for second opinion. A good doctor, like I said, is a doctor who knows their limitation and refer appropriately when the time arises for such things. A doctor
Okay.
should not say, I don't know a thing, and then not signpost the patient to where they need to get help. So nobody knows it all. So, but it's important. Like, it's a neurological condition. And in Nigeria, we have less than 100 neurologists managing 220 million people. So you imagine access to proper diagnosis is really, really poor. And now that is a case that is rare, it's not a common case. So you won't expect much people to actually have that high index of suspicion, except you have been trained to be able to identify such.
Less than 100, you said?
Yes, neurologist is actually less than 80. And with this japa, maybe those of us left in the country are less than 60. Some of us are patriotic enough to stay and produce more doctors, but we will encourage the government to encourage the workers, because the workload, like I said, 70 neurologists managing 230 million people is huge. But if we have the government encouraging us to stay, supporting welfare, ensuring there is security and infrastructures in place, some of us would love to stay back and not go and use our hard-earned knowledge to save other countries.
Thank you so much for your time. Honestly, I'm really grateful. Is there something that I didn't ask that you would like to touch on real quick?
Yes, it's very important to talk about the symptoms, identification of the symptoms, so that the people will have high index of suspicion. Usually, people with muscular dystrophy, what they often complain about is weakness of their muscle, having difficulty standing up from a sitting position or a lying position. And some could actually complain of muscle pains from mild to moderate to very severe. About 25% of them complain of severe pains. And so generalized weakness in a small child, a male child, should raise index of suspicion. When you are always getting weak, the child cannot run for a while, falls, when they start falling too frequently, these are the things that one should start looking out for. And then pains in the muscles. And then as time goes on, somebody could start having, if it affects the face, it might have speech problems. So these are the things that we make someone to actually seek for help early. Because if you start treatment early, quality of life is good.
I think maybe at some point we also need to educate religious leaders because a lot of Nigerian parents, their first line of thought is to take to pastor for prayers. When
Oh, that is very, very important. There's something we call patient public voice or initiative, where you bring everybody on board for them to educate them. I know all of us, we are religious in Nigeria, but it's important for religious leaders to also encourage their parishioners to seek medical help.
Thank you so much, ma'am. Really, really appreciate having you.
Thank you for having me.
Thank you.